It's open enrollment time for your health insurance, and it's crucial that you pay attention to see if there are any changes coming to your health insurance plan for next year. I'm going to point out a couple to be on the lookout for. That more coming up. My name is Mike Bernard. I'm the host of the Wise Money Show. I'm also one of the certified financial planners right here at Korhorn Financial Group. Make sure you hit that subscribe button, turn on notifications, and smash that thumbs up button. Your health insurance decision isn't just this side financial decision that you can just neatly tuck in a corner. It's a financial planning decision. You need to be aware of how the health insurance, the plan that you select, impacts all 6 areas of your financial life. Your cash flow, of course, but then also whether there are any tax advantages for it, both the premium that you pay, but also the ability to contribute to an HSA, and how you treat that HSA from an investment standpoint, retirement standpoint, touches a lot of different areas of your financial life. And I'm not sure the time you're absorbing and using this content, but the time I'm recording it, it is open enrollment season, no matter where you get your health insurance. If you get your health insurance from an employer, you've got group provided plans, you need to make sure that your company isn't making any big changes for next year that you need to make a decision on. I have heard recently from a fan of the show who was saying that, yeah, 1 year he was really busy during open enrollment and just assumed everything was fine, missed his meeting with his company because he was busy, and turns out when he went to use his health insurance in January, everything had changed. The deductible was different, the company was different, and he was completely oblivious. So make sure that you're aware if you've got group employer provided plans. Oftentimes you're thinking, nothing's changing, it's just staying the same. Be aware. Make sure that you're aware. Is your plan HSA eligible? How much are you contributing to your HSA? And you know, who's in network and so on? What changes are being made? And through your employer, if you have multiple plans available to you, doing the math and sitting down working with your CFP to say, well, which plan is most appropriate for my financial situation? That's all coming through your employer's open enrollment. Many of them are are in open enrollment right now. You may have just passed yours. Yours might be still upcoming, but that's if you have health insurance through your employer. If you get your health insurance through Medicare, yep, it's Medicare open enrollment season right now as well, going from October 15 to December 7th. And during this Medicare open enrollment, you can make a few different changes. If you're on a Medicare Advantage plan, Medicare Part C, you're going to want to look around and make sure that you still have the right plan, and there isn't that you don't want to shift to a different plan for the upcoming year. A lot of people are making those or sitting down with their health insurance expert and looking at those plans, those options, and making a shift if they need to. But also big changes coming to Medicare Part D. And this is also a window during Medicare open enrollment where you're able to shift Medicare drug plans. And with the Inflation Reduction Act, arguably one of the worst names of a law in history, but they're shrinking or they're closing the donut hole that used to be there for prescription drugs. And in the process, that's going to change a lot of the cost of these plans. Not a big shift coming in 2025, but could be a change in what formularies are covered or what even pharmacies are covered. So you're going to want to talk to your health insurance expert, review your Medicare Part D, and if you're on Medicare Advantage, review that as well. That is all during Medicare open enrollment. And finally, and this is where in our neck of the woods, there's a big change coming with this. I'll share that right now. And that is if you get your health insurance through the Marketplace or Affordable Care Act or healthcare.gov. It has all sorts of names. Those are just 3 of them. But if you get your health insurance through healthcare.gov, your open enrollment goes from November 1st all the way until January 15. You have to get on a plan or enroll or update your plan by December 15 for that change to be effective on 1/1. But technically, open enrollment does spill into the new year a little bit, and then those changes would take effect on February 1st. But this is where, if you have your health insurance through healthcare.gov or the Marketplace, that you're going to want to go in and do a couple different things. One, you're going to want to update what you're expecting your income to be for 2025. As you know, lots of planning implications here. That influences how much advanced premium tax credit you're going to get, right? How much you're going to have to pay on a monthly basis for that health insurance plan. It all gets trued up when you file your taxes at the end of the year, and if you're projected income was exactly spot on with what your income was, fantastic, everything's square. If your income was higher or income was lower, you're either going to have to repay some of those premium tax credits or maybe get more added to your tax return. It all gets trued up. So that's the one thing you're going to do. But then the second thing you're going to do is see if you should make any plan changes. Whether you want to shift from a silver plan to a bronze plan, whether you want to shift from an HSA plan to a non-HSA or vice versa, or whether you want to shift from one company to another based on what's in network and what's covered and so on. So you're going to want to review your health insurance options through the marketplace and select your plan for the next year. This is critically important because, just like I mentioned earlier, plans can change, coverage can change. One provider in Michigan, Ambetter, actually has just announced that they are no longer offering any high deductible health plans that are eligible for an HSA starting in 2025. Now, they have been offering HSA eligible plans for 2024 and previously. And so if you are on one of these plans, your new plan is going to be mapped over to a non-HSA eligible plan. If you weren't aware of this and you were funding an HSA, you're no longer able to do so. And that could mean a big mess and potentially penalties. If you're oblivious to this, don't realize the change, continue making contributions to an HSA when you're not eligible, that can be a big problem. So being aware of what changes exist, this is a pretty big one. For those of you in Michigan on Ambetter, you're going to want to work with your certified financial planner and, more importantly, your health insurance expert to see what adjustments you should make, whether it is okay for you to just shift to a non-HSA plan or if there's a different company out there, a different plan that is HSA eligible. Personally, I'm a big fan of the HSA. We are, because of the tax planning opportunities that it provides for you. So work with your health insurance expert. Be aware of any changes that are going on with your health insurance coverage, your health insurance plan. See if there's any changes that you should make and make sure that you're all set up for 2025. Work with your certified financial planner on that. If you don't have a CFP on your team, you can contact one on my team. Find us online, Korhorn.com. That's Korhorn with K, wisemoneyshow.com. You can find us there as well, or give us a call, 574-247-5898. All right, there you have it. Go out and take your next wise step in your financial life.